Hi, I'm Dr. Shilagh Mirgain, a health psychologist at UW Health. Today, I will lead you through a simple breathing exercise called diaphragmatic breathing that you can use anytime to influence your health. This type of deep belly breathing reduces stress, lowers blood pressure, and promotes relaxation in your system. It strengthens the healing response in your body, so you can also better recover from illness, injury, surgery, and cope more effectively with a chronic health condition. If at any time you find this breathing exercise to feel uncomfortable or produce some agitation, please discontinue it and let your nursing staff know about your experience. So let's begin. First, bring your awareness to your breathing. Notice where in your body your breath is moving. Are you breathing down in the abdomen and belly or up in your chest? Is your breath slow and long or short and rapid? It's very common for people to do shallow chest breathing. This type of breathing is often referred to as stress breathing, as it's associated with that fight or flight response or that stress response, where more stress chemicals are released in the system, and there's often a lot of muscle tension when we breathe this way. Instead, what I'd like to walk you through is how to learn how to breathe in a way that promotes relaxation in your body and mind through practicing diaphragmatic breathing. This type of full, deep belly breathing involves the main muscle of breathing known as the diaphragm that moves down on the inhalation, giving room for the lungs to completely expand with air. Then the diaphragm reverses on the exhale. So as we breathe in, that belly goes out like a balloon filling with air. And as we breathe out, that belly deflates, so it's going in towards the spine. With diaphragmatic breathing, getting a full, nice, deep breath is our goal. So let's start this breathing practice. First, begin by taking several long, slow, deep breaths. Your breathing rate should feel comfortable, so don't force anything. Breathing in fully and exhaling fully. I invite you to breathe in through your nose and out through your nose or mouth. To help you, it may be good to place your hand on your stomach just below your rib cage, so you can feel your abdomen rise and fall as you breathe. As you breathe in, feel your belly going out like a balloon filling with air. And as you breathe out, feel your belly go in like a balloon losing air. Breathing in, stomach expanding. Breathing out, stomach deflating. In and out. Allow your breath to find its own natural rhythm. On the in-breath, feeling this breath traveling down from your nostrils down to your lungs, causing your belly to expand. And notice each out-breath, that as your belly contracts, going in towards the spine, the air moves up through your lungs, back up through your nostrils or mouth. Invite your full attention to following your breath, feeling that natural rhythm. Breathe in a way that feels comfortable and easy. Follow the air all the way in and all the way out as you breathe in and breathe out. Really track your breath moment by moment. If your mind starts to wander, thinking about the future or the past or concerns, just see if you can notice that mind wandering without judgment. And just gently guide your awareness back to your breathing. Now experiment with having the breath slow down just a bit if you wish. On the in-breath, just see if you can have a nice, slow breath in. And on the out-breath, just see if you can lengthen the breath out. Having a really nice, slow out-breath is what's very calming to the body and mind. You might practice breathing in for the count of 2 or 3, and then breathing out for the count of 3 or 4, allowing that out-breath to lengthen and deepen a bit as you silently count the numbers. Breathing in for the count of 2 or 3, breathing out for the count of 3 or 4. If this feels comfortable, you can even lengthen this breath just a bit. Breathing in for the count of 4 and breathing out for the count of 6. Find the rate that feels most comfortable for you. And you might observe as you're practicing the slower, deeper breathing, lengthening the out-breath, that your body is releasing some tension and your mind can feel more calm. And if there's any sense of strain, just see if you can invite some ease with this practice, not forcing or trying anything too hard. You might experiment with using some imagery, like you're seeing an ocean wave coming in and out of shore while breathing in and out. On the in-breath, seeing the ocean wave coming into shore, and on the out-breath, seeing that ocean wave leaving shore. The wave coming in, the wave going out. And if your mind wanders, just notice this, not judging, noticing it as neutrally as possible. And then just imagine letting that thought go, like it's a leaf floating down a stream or a cloud floating along the sky. Noticing the thought as if it's that leaf or cloud floating past you, and then letting it go out of sight. And then gently bring your attention back to your breath. This breath can be an anchor you can return to over and over. It can help ground you back in the present moment and help you recenter when you become distracted by thoughts. Notice the breath rising and falling. Practice coming home to the breath with your full attention, watching the gentle rise of your stomach on the in-breath and the relaxing letting go on the out-breath. Just enjoy observing and completely being with your breath as it flows in and out, feeling the breath breathe you. And you might notice being distracted by pain or discomfort in the body, or itching or twitching sensations that draw your attention away from the breath. Maybe there's some feelings arise related to these sensations, some sadness or frustration or agitation or anxiety, or even happiness and contentment. Acknowledge whatever comes up. Feelings or thoughts or stories about your experience or any distractions. And just see if you can notice them compassionately and kindly. Just notice where your mind went without judging it, having to push it away or cling to it or wish it was different. Just notice it. And then simply refocus your mind and guide your attention back to your breath. This breath is an anchor, anchoring you here and now. Breathing in, you might breathe in some peace and calming. And breathing out, just releasing anything you don't need to hold on to. Breathing in, relaxation. Breathing out, tension. Breathing in, a sense of health and well-being. Breathing out any stress. Just enjoying the natural rise and fall of your breath at that rhythm that feels very comforting. Feeling the nourishment as your breath breathes you. Breathe and be. Breathe and be. And as this practice starts to come to an end, taking a few last deep breaths, slowly allow your attention to expand and notice your entire body. And then your awareness can expand, noticing beyond your body to the room you are in. When you're ready, bring yourself back fully alert. If your eyes were closed, open them and come back refreshed and fully awake. I encourage you to think about integrating this relaxed breathing into your activities and day. The breath is always with you, and this slower, deeper diaphragmatic breathing can become a positive health habit, one wonderful tool that you have in better managing your health. Thank you very much for doing this practice with me today. Have a wonderful day.